Hello students, welcome to the part 2 of the respiratory system. In the last lecture we have completed the different organelles, okay, and where they are present and all. In today's lecture we are going to start how does this respiration exactly occurs. Okay, so we'll start with the part. See, what are important have been already boxed up, that is the nasal chamber, okay, the pharynx. See, through mouth, this is the mouth part and this is the nose part, and they are meeting out here. This pharynx is very important. Epiglottis. What is an epiglottis? This function of the epiglottis is very important. This vocal cord, which is also called as the larynx, okay. Then this esophagus, through which the food is going to travel, and this trachea, through which we inhale the air. So the work of the esophagus is to take in the food, okay. This is also called as the food pipe, and trachea is also called as the windpipe. Now we will understand about the epiglottis. What is the function of exactly the epiglottis part? See, whenever we eat food, so very oftenly, okay, while having lunch or dinner, when we talk with someone, so suddenly our food, okay, it does not travels to your food pipe at that particular period of a time. It travels through your windpipe, okay, and due to this you feel uneasy for a particular period of a time. Now the reason is, see, there are two pipes. Food pipe and a windpipe. Food pipe and a windpipe. Suppose this is wind and this one is the food pipe, which is called esophagus. And this is the food bolus. This is the food bolus, and this is traveling through the esophagus part. Okay, this is the food pipe which is traveling through the pharynx part. Now this food have a two option to enter. Either it could enter into a food pipe or either it could enter into a windpipe. The proper destination of this bolus means this food, okay, ball, should enter into a food pipe, not the windpipe. But very oftenly it travels into an windpipe, and due to this you feel uneasy, unconscious, okay. But there is a flap which is present out here, and this flap is nothing but the epiglottis. Due to this flap, see, whenever we in a normal 24 hours, see, we eat like 3 times, okay, lunch, dinner and breakfast. Due to this, during this period the food pipe is open, so food usually travels through this part only. But most of the time this food pipe is closed, because see, 24 hours you don't eat, but for 24 hours you breathe. So this, the function of this epiglottis is very important, okay. So that is why parents always advise us not to talk while eating food, because the food might enter into your windpipe. So this is nothing but the flap, okay, we can see out here. This is a flap which helps to prevent this part. Now this is an gaseous exchange of the alveoli. See, this white color structure is the alveoli, and this is the blood capillaries. Here the inward diffusion of oxygen and outward diffusion of carbon dioxide takes place. See, as we know, the walls of the capillaries are very thin in nature. So what exactly happens is, see, we take in air, okay. So when we take in the air, it travels into the alveoli part. It moves into the alveoli part, and from this alveoli it get transported inside this capillary. Okay, the oxygenated blood gets travel inside your alveoli part, and when this oxygenated blood, okay, the oxygenated blood which is present, okay, in this capillaries, see this capillaries get moved through this plasma, which is nothing but your liquid part of the blood, and this oxygenated is taken by this RBCs, and this RBCs helps to transport the blood to each and every part of the body through this pulmonary artery out here. But when the blood get deoxygenated, okay, when the blood get deoxygenated, it moves out of this capillaries. Okay, see the inward arrow show that there is a diffusion of air inside the capillaries, and diffusion out means this sign. This is showing that the air is moving outside, and through this alveoli only reverse happens. Okay, this is an inhalation process which moves in, and this is an exhalation process, it means moving out of the carbon dioxide. So basically we are going to learn about the breathing respiratory cycle. Okay, so they are divided or classified into two parts, that is the inspiration and the expiration. So first, what do you mean by the word inspiration? See, when we inhale air, the inhaling of air is called the inspiration part. But expiration means what? Expiration means releasing out of the air. Okay, so one by one we will see up the diagram related part, so we can clear this part. Inspiration. See, when we breathe in, so at that period of a time our rib cage, okay, move upwards. Okay, the chest size expands because we are taking in the air. Okay, and the rib size also gets increased. And this diaphragm, okay, this muscular sheet, okay, which helps to separate your thoracic region and the abdomen part. Thoracic means the lung related region, and your stomach related region, this diaphragm. Okay, this diaphragm get contracts and flatten downwards during inspiration, get contracts and flatten downwards. But while breathing out means the expirations, the air which is present inside our lungs get expelled out. Okay, due to this the rib size, the chest get contracted, and the chest get contracted and the diaphragm form up a, and due to this your diaphragm form up a shape of a dome like this. Okay, like a dome, because it helps the body to come into the natural position. Now we are going to learn regarding the breathing movements. See, inspiration and expiration. Diaphragm, the diaphragm get contracts and flatten downwards. We have seen the diagram right now, okay, of inspiration. Okay, see, this is nothing but the flattened part, and this is moving downwards, but it helps to form up a dome shape. Why dome shape? Because now it's going to move up, and this here it is like this, so this is forming up a shape like a tunnel, like a dome. Okay, there are the muscles. Okay, what are intercostal muscles? Intercostal muscles are the muscles which are present between the two ribs. Okay, the two ribs, see, we know that part very well. There are the rib cage, okay, which helps us to protect our heart and the lungs part. But there are the muscles which are present between the ribs are called as the intercostal muscles, because the inter means between and the coastal word means ribs here. Ribs, inter means between. So between the ribs there are muscles which are called the intercostal muscles and the external costal muscles. Now what is important is diaphragm, rib cage, thoracic, air pressure and air movement. This is not that important. Second point, what is going to happen if I'm going to take in the air? So at that period of a time, our chest size will increase. So definitely it is going to move upward and outward. Okay, but during expiration, it is going to move downward. The ribs, the chest size will get decreased, so it is going to move downward and inward. Thoracic cavity. See, whenever we inhale, so at that period of a time, our chest expands. So thoracic cavity is nothing but the chest related part, which increases, and here it decreases. Air pressure. See, decreases inside thorax and lungs. Okay. Decreases inside the thorax and the lungs. Air pressure. Suppose I give you an example of a diffusion. What is a diffusion? Diffusion means moving of the molecules from the higher concentration region to the lower concentration. Okay, suppose now I'm going to make up lungs. Suppose there are two molecules out here. So inside these lungs, there are very few molecules of air. But here, the outside air contains a lot amount of the air molecules. So what is the function? The air always moves from the higher concentration region to a lower concentration region. You have already studied this in a geography or chemistry or something. Okay, and this air is going to move inwards. So that is why the air decreases inside the thoracic. So that means the air pressure inside the lungs is less and the outside one is more. So the air is going to move inwards, and due to this the chest cavity increases. Exactly reverse happens out here in the case of the expiration. Here only two molecules I am going to make. Here more molecules inside the lungs we are going to make. So now where the air is going to move? From the higher to the lower. Here the air molecules are more and here the air molecules are less. So it is going to move in the opposite direction. So air movement, external air pressure drives into the lung at a low pressure. And here air forces out of the lungs by the compression and elastic recoils of lung. Now capacities of the lungs. There are different types of the capacities of the lungs. First we are going to learn about the tidal movement. See, we should know that part. These figures are very important. Our total lung capacity, both lungs, that is the left lung and the right lung, it is around 6000 ml. Okay, 6000 ml is the capacity of our lungs to take in the, okay, to accommodate the air. Okay, now we are going to start one by one. This is the tidal volume. What do you mean by tidal volume? See, normally when we breathe in or breathe out, it's called tidal volume. It is around 500 ml. 500 ml. This is the normal capacity. Okay. Second, inspiratory reserve volume. See, when we forcibly withdraw the air inside our lungs, so that capacity is around 3000 then. So now this 500 and 3000 will make your 3500. This is called the inspiratory capacity. What do you mean by reserve volume? The maximum amount of air which we can withdraw is 3000. And what is inspiratory capacity? The total amount of the capacity, okay, which is now become 3500. Now expiratory reserve volume. What is expiratory reserve volume? See, the forceful air which get withdraw from the lungs is around 1000. Okay, reserve, because this is reserve. Now this inspiratory capacity and this expiratory reserve volume together constitute 4500. Okay, 4500. What is the total capacity of the lung? The total capacity of the lung is around 6000. Okay, 6000. Now total vital capacity. What is a vital capacity? Vital capacity means the volume of air that can be taken in and expelled out by the maximum inspiration and expiration. So means the total inspiration and expiration, the total is around 4500. So what is left is 1500. This 1500 is nothing but the residual volume. What do you mean by the word residual? Residual means the leftover part. This amount of the air is there inside your lung right now. So this is very important. Inspiratory reserve volume, inspiratory capacity and all. Why people on higher altitude face difficulty in breathing? The common sense. See, we'll understand. Suppose this is a hill and this is a plain surface. The people who lives on a normal plains and the people who lives at a very high altitude. Altitude here means the height, okay? The people at the plain has a lot amount of air, okay? There is a lot amount of the presence of the air, and the air out here is very denser. So it becomes very easy for a person to breathe in and breathe out, okay? So that is why on the plain region the people does not feel any kind of a difficulty in breathing. But what happens at a higher altitude, means at the higher height? See, as we move upward, okay, at the higher altitude, the amount of the air decreases, okay? The amount of the air decreases. The air on the top of the mountain is thinner, okay? Means there is a less amount of air which is present, okay? We know that part at the higher altitude, okay? At the higher altitude, as we move toward the higher altitude, there is always a decrease in the pressure, okay? The pressure is very low and the volume of the air is very less. So that is why the people often feel very difficult to breathe in, because here the air is thinner and here the air is thicker, okay? So there are two different parts, thinner and thicker. Thinner when we move toward the higher altitude and thicker when we are at the plain. So that is why we don't feel any kind of a difficulty in breathing in. So there are two different conditions which are related to respirations, okay? First, hypoxia and asphyxiation. What is hypoxia? See, when there is a deficient amount of oxygen in the body, it causes hypoxia. This experiences can be done at the higher altitudes where the pressure is very low, okay? Higher altitude pressure is low, okay? At the higher altitude the pressure is very low, and due to this there is an insufficient amount of oxygen in our body, and due to this there is a difficulty in breathing. It can be also, this condition can be also felt when you sit for a long hours in a crowded room, okay, with poor ventilation. Suppose in school example, okay, if your rooms are closed from four of the sides, okay, if your rooms are closed from four of the sides and there are a lot of students, okay, in one classroom only, so after few times you will feel suffocation, okay, because many of them are breathing at a particular period of a time. So that is why there is a less amount of oxygen that is present in that room, okay, and there is a lot amount of the carbon dioxide got accumulated inside the room. So that is why a person always feel uneasy in a very crowded room, okay? Now what is asphyxiation? Okay, now this asphyxiation is nothing but hypoxia only, okay? It is nothing but a hypoxia only. But asphyxiation, in this condition the blood become venom. Venom means poisonous. Venom means poisonous, okay? The blood become very venom. Venom means very poisonous because there isn't too much amount of the carbon dioxide inside our blood, and this, due to this there is a less amount of oxygen which is present in our blood supply. So due to this it can lead to several causes, okay? It can also lead to death, it can also lead to death. Whereas hypoxia can't lead to a death. Asphyxiation means for more longer part, for more longer hours, for few hours. There is a difference. Hypoxia condition occurs for a particular period of a time, but this particular period of a time get extended for a longer period of time can lead to an asphyxiation. Okay, like drowning condition and all. Drowning means if any of the person, okay, who does not know to swim and all, so that drowning. Okay, so when we remove that person from that part, from the sea or from the water or something, so that person feels uneasy because the blood become venom of his, and it can also relate it to death. So what should a person be done? Okay, if a person who is drowning, okay, he does not know how to swim and all, and he is drowning, and we help that person to get out of this part, but at a particular period of a time, when we make him move out of that swimming pool or something like that, he feels uneasy. So what should be done? We should take an artificial respiration. Okay, we can give him the artificial respiration so that he can quickly get recovered through that asphyxiation. So thank you, students. This was the part 2 of the respiratory system.